The World of Marijuana by MTV. This is a book about marijuana and how far it's going and where it's going and where it's come from. It's the history, the current, and the present, and the future. The Control Act of 1970 classified cannabis, heroin, and LSD as Schedule 1. Now, there are 5 schedules. Schedule 1, 2, and 3 have the most addicting, most abused drugs in it. Schedule 3 have your benzos, such as prazolam, lorazepam, and diazepam, also known as Xanax, Ativan, and Valium. You got your muscle relaxers in Schedule 3. Schedule 2 has your opiates. Schedule 2 has opiates like Percocet, Loratabs, Oxycontin. All the opiate group is pretty much in there, except for a few. But the ones with opium in it are going to be classified in Schedule 4. It was not until 1545 that the Spanish brought cannabis from overseas to what would become America. Cannabis and tobacco at the time were the main cash crop. The Spanish actually brought the name marijuana to America, and it was a cash crop for a while, and then cotton took over. Now, it's becoming a cash crop now, even though it's mostly illegal in many states. But when it is legalized, some states are going to make $400 billion off of this. When the first stores opened for recreational use, they were making millions of dollars a day total. Millions a day. And we're talking about very controlled, very hard to get licenses for these stores. So it's just amazing. In fact, you can get up to 1 gram at some stores from out of state if you go to a place that sells marijuana. Not only was it used recreationally, but many products had cannabis in them, including fiber, paper, nautical use, lamp oil, food, etc. In fact, medicines for a while had marijuana in them. Not many of them, but some of them did. Most medicines contained a hefty amount of cocaine and heroin. Not all of them, but some of them did. Even the national group AMA, the American Medical Association, is calling for a reclassification of marijuana. What's happening is we want to be able to study. We want to study it in America at a national level. And right now, with its Schedule 1, the government is forbidding this from occurring. We can't see what it does to patients. We can't do a lot of research. We can't do a lot of. It's restricting the usage. We're having to rely on studies done from other countries. It's really hampering the effort to find what medical marijuana can do for us. It is a $1 trillion bracket that the U.S. government spends, the national government spends to help control trafficking of marijuana and marijuana-like such offenses. In fact, the Mexican border during the Reagan and Bush administrations were heavily guarded. Forces were boosted up to protect our nation's security. As they tried to stop marijuana from getting into the country. From then on, it came from mostly Hawaii and Florida, California, other states, but it was being grown inside the country. Now, there is such a thing as Mojo. That's a synthetic marijuana. I'm sorry. Big difference. Synthetic marijuana. And the DEA has been going after these synthetic marijuana companies, and what they do is every time they get caught, popular ones are K2, Spice. They were at one time sold in drugstores, gas stations, all over the place. You can still find them, but they're synthetic marijuana, but they're very harmful for you. They actually have death statistics with Mojo. And as for marijuana, it will not kill you. THC is not deadly. it will raise your heart rate. The product itself will raise your heart rate up 20 to 40 beats per minute. But, I mean, a healthy human being takes marijuana, they should live. A healthy human being takes Mojo, not so certain. I remember hearing from a nurse firsthand that she had a patient in a psych ward, and they were demented, not demented, that's a bad word to use. They were psychotic, delusional, and they were very, very, very frustrated, angry, confused, and it can take 3 days, 4 or 5 days for it to go away, the effects of Mojo. It can take weeks. It can take months. You can die from it. It is a disaster, and the DEA goes after every... And what the companies do is they tweak the chemical slightly so it's not the same, and then they resell it under another label. That's basically what they're doing. Mental illness. Now, this is one community one pillar of the medical community that is not so sure about legalization of marijuana for medical use or mainly recreational usage, but even medical use, because it hasn't shown, there's not a lot of evidence showing it causes bipolar. It can cause bipolar, but that's a little iffy. But there is evidence that shows that bipolar patients who smoke it will get severely worse. Whether this is long-term, short-term, once again, it's a Schedule 1. We need to lower it to a Schedule 2 so we can do our own research. Schizophrenia rates. I thumbed through countless pages of information, study after study after study, because it was just alarming what the schizophrenia rates are in reports from Great Britain and other countries. It does seem that drug-induced schizophrenia does occur with marijuana, and that should be a scare. There's also other things. For instance, 10 IQ points less as an adult they found in chronic users of marijuana. But then again, chronic users of alcohol, what do they have? There's a limit to everything. The World of Marijuana by MTV. It's on your Amazon bookstores. You're free to post a comment, ask a question. There will be many more books being placed up here momentarily.